Hi everybody, Dr. Qazi. I'm over in Newport Beach, California. I'm going to go over this case just really with the progress report, essentially just showcasing the patient's healing process. For those just joining me, I specialize in acne and scars and pigmentation. Also, I do a lot with collagen and facial balancing. So I'm going to showcase this patient right over here. He's a really, really nice gentleman, comes in all the way from Texas. And just to show that scar healing process right here. So if you take a look at this patient, I will kind of start just kind of talking a little bit about how I do scars, and then also just how I make sure that you can recover in as safe as possible way. This particular patient, even though he looks lighter skin, he actually is Fitzpatrick 4. He does actually otherwise get some pigmentation. So we have to be very careful with the skin as we worked on it. And he healed incredibly well. So I'll showcase a little bit of his after results in just a little bit as well. But I just want to kind of walk you through just some of the journey as we've treated him, and kind of help you guys kind of see what to expect just that normal healing process to be. It's really not as daunting or as scary as some people think. I had a patient today, and I told her that we're going to have to do CO2 laser, and she got really concerned, and she said, I've heard horror stories about that, and she goes, it's not going to be fully ablative. I was like, well, no, it is. It's going to be fully ablative in some spots, and she got really more concerned now, and it's understandable. I do see a lot of the same things that a lot of people see, where you see all these people really burnt up. You get concerned that that's what's going to happen, that you're going to get really burnt, and it's going to be like a long recovery process. It really doesn't have to be that way. I prep your skin really well before we do this treatment, and it's pretty much like a very standard way to help patients heal. I kind of want to have you guys just kind of go through some of this process and just kind of talk a little bit about it, and you could just kind of see as I show some more slides and some more photos, just to kind of what to expect if you kind of underwent this. So with this patient, we ended up doing subcision, and then we also did ablative CO2 laser in some parts. We also did TCA Cross for him, and you can see just the day two, already significantly improved just with his healing process. It's really not terrible. Just some crusting just still remaining on his cheeks, which I'll still allow for the next couple days, and then I'll have the patient do what's called vinegar soaks, and they could do that to try to get rid of some of that debris. Otherwise, what I mostly try to do right now is just moisturize a lot of sunblock right now. What is this treatment called? This is basically where we did subcision for the patient, we did a CO2 laser for him, we did TCA Cross for him, and it helped out a lot actually for his scars. I'll show you his result in just a few moments actually, so you can kind of see for yourself, just kind of see what that process is and why it's worth it for a lot of patients. Here's this same patient. So essentially you could see where he was in January, and then where he was when I saw him last time in September. So you can see that little journey right there. And it's significantly improved in the 9 months over there. So take a look at this. You can look at that in 9 months, significant improvement of his scars. He's super thrilled when he came in. So he comes in from Texas, and he came in, we just cleaned it off a little bit more, did a little bit more TCA Cross for him, did a little bit laser for him. But you could see that really it wasn't like that big of a healing process. I want to kind of explain that for people because of just what happened today with this patient who was so concerned about doing subcision, so concerned about doing laser. And I hear about all those things. She wasn't particularly concerned about TCA Cross, but I've also heard people really concerned with TCA Cross and that, which I understand. I'm not saying that it's not daunting. I take it very seriously. I take the responsibility very seriously. But there's a way to do this, and it could end up being really amazing for patients. So just go to somebody who does a lot of it. Go to somebody who does it really safely and very, very careful with that. Let's see here. I'm going to answer some questions here. N is saying, how do you feel about clindamycin and tretinoin gel for acne? Some derms don't like clindamycin. It's the thing with clindamycin is that you can get resistance pretty quickly. With it, it's a good product, but you could get resistance pretty quickly. Usually with clindamycin, if you're doing that, typically you want to do something with like a benzoyl peroxide with it a lot of times, although that could be overly drying. So I prefer to use Dapsone. You can still get resistance to it a little bit, but like the thing is that it's less irritating, less drying, and you usually have a really good clearance in just after a few weeks of your acne. So I usually prefer Dapsone. Queen MB saying, hello, breaking out from Panoxyl tips. So that's exactly what I was talking about. It's possible that it's overly drying your skin. And when things overly dry your skin, you basically get a rebound effect where you produce more oil. And then if there's bacteria over there on the surface of your skin, then you could actually end up getting a cystic acne. So we got to kind of be careful with that balancing act. I typically don't actually use that much benzoyl peroxide. I know a lot of people will love benzoyl peroxide. They love benzoyl peroxide, and they sort of view it as like almost like, you know, just a religion sometimes, that you know, when you're doing this, you have to constantly have a benzoyl peroxide, and they'll tell you over and over. But the truth is that it really is really harsh on the skin. It can be overly drying for a lot of patients. And, you know, we now have a lot of evidence about the issues with benzene too. So I think we should be careful with it, honestly. You know, there may be other options. Sulfur is a good option. You know, maybe consider sulfur. Let's see here. H is saying, it's been a month since my fourth cure at your office. What can I do? And I missed the beginning part of that question, H. What can you do about acne? Well, if you still have a little bit of acne, it's normal right now. Most patients who you could talk to, I've actually had some follow-ups with some patients today as well who were on the 3rd to 6th month of the cure laser after their last session. And they really said there's a big difference between by the month 3, where it was much better, and then by month 6, it was much better. So let's talk, you know, talk to my office. If it's big cystic acne, I may want to do a little bit of a steroid shot, or we could do a BBL, which is broadband light. It'll kill the surface bacteria, so we can maybe stop that. And I probably will going to want to put you on a topical antibiotic and tretinoin. So let's talk to my office tomorrow, and we could try to set that up and see if we could send that over for you. And I'm sure one of our team could actually be able to help and just see you pretty quickly. We don't want anybody to have breakouts while it's still kicking in there. Let's see here. Do you have any openings this weekend or next week? I already had my consultation. Awesome. You know, I'm not really working much on weekends anymore, just for a couple people that I still had remaining for the year, but I'm pretty much winding down a lot with my weekend work. And so probably not going to have anything for the weekend. But we'll be happy to help you out, though. Just during the week, just let me know. We also do lots of virtual consultations. So H is saying that they are using Dapsone gel and it's not helping yet. Not sure how long you've been using it, but I could always change it around. We could take a look. Also consider doing sulfur wash. But if it is really big, like a cystic acne, we may want to do like an oral antibiotic for a short burst. And then we may want to have like a sulfur wash, things like that. So let's take a look and see what's happening specifically for little breakouts that are still happening there. Queen MB is saying, how to stop picking painful acne. You could try actually doing silicone tape. So use silicone tape. If you're able to do it during the day, do that. But at nighttime especially, it helps with the inflammation for acne. So I would recommend doing it that way. Silicone tape helps as well. And H, by the way, you should consider using that too. Silicone tape really could help with the inflammation of acne. So that friction that occurs while you're sleeping sometimes can make it a little bit worse, that inflammation. So really something to consider is silicone tape. But let's see, you know, I may have to change up with antibiotics. If you're still having some acne, we may want to change into maybe potentially oral antibiotic. It just depends on what's happening. Is Accutane still offered? Yes, I still prescribe Accutane. I still have patients on Accutane, and certainly, you know, for some patients it makes sense. I always say that, like, I want you to do something for your cystic acne. It's okay what you decide to do. I want you just to have like an understanding of what the best options are, and you know. It's certainly going to be important to reduce your cystic acne so you don't get scars like this. So whatever you do that. That's important. But like, let's say you can't tolerate the side effects. You're concerned about the side effects. You're trying to get pregnant soon. It can't be on 2 forms of oral birth control. Or birth control if you're a woman, things like that. Then we may want to consider some alternatives, like something like the Accutane laser, which we were talking about earlier. And I was on myself also Accutane 3 times. I know it helped, but it definitely had a lot of side effects. There's no question about it that it had a lot of side effects for me. And I'm glad I didn't get significant scars because I was on Accutane, but there was no question that it did. So, you have to weigh those pros and cons, each individual. I want you to be aware of that. I just really don't want you to have bad cystic acne. I don't want you to get scars like this. It's I'll be happy, honestly, if America and the world no longer has acne, no longer has scars, it's awesome. My job is done. I'm really, really great. That's just really, really great. And for me, honestly, I want that in life. I want it so that this is solved and nobody else really has to suffer from first acne, the social trauma that is acne, just the mental anguish that could occur with acne. And then I don't want people to suffer from the scars afterwards. It's really sad and tragic. So many people, my patient that I worked on yesterday, he had such severe scars. He said he knows when it happened when he was 16 years old. Everything was going well, and he had such terrible acne and such terrible, terrible scars, destroyed so much of his fat and just his skin, everything like that. And he just felt like his confidence was just so destroyed from that. And it happened when he was 16 years old. It's so sad. So I want you to do something for cystic acne, and I do take it very seriously. Anybody says they're still breaking out after treatments I do, I will help you work it out because I don't want you to have that. I don't want you to suffer. I do not want you to have scars. It's really important for me that we don't have to worry about these kind of scars. I want that for you. So talk to me, about these things. If you want other options, if you're worried about other side effects, things like that. But whatever you do, just know that we want to solve your cystic acne so you no longer have these scars. That's what's so critical for me. What helps with a burn scar? It depends on how old the scar is, what kind of scar it is, what kind of burn it is. I did a lot with burns, so let me know. I'll help you out with burns. Actually, I do a lot. It's something I love to do, actually. Something I've told you guys before, I'm planning on going a lot more into burns too, just to kind of really go through it a lot, because I'm planning on doing a lot eventually one day when it's safer to do it. But I do want to help out all these people, all these poor kids in Gaza who've been burned. I want to start working on them and really help out with their skin and figure out how we could help with their skin contraction, all the terrible burns that they're having. Let's see here. Do you have to stay out of the sun for a few weeks after the procedure? Well, you do want to make sure that for at least for 6 months, potentially even more, that you are not going out in the sun, really. Yes, your pigmentation is a problem, number one. But on top of it, just UV damage actually could prevent collagen production. So we want to make sure that you have a robust collagen response. And if you aren't going to have that, because of sun, that'd be really tragic. That's something you could have controlled. So you controlled, what you could control, and sun is something you can control. You can control smoking. Can't control your genetics, but you probably could control your diet, things like that. You could probably make sure that you're not drinking a lot of dairy, things like that. Also, I even said before, I found that there's an issue with water sometimes, that some places the water is really high in minerals, and it potentially delays and prolongs the healing process. So that's something you should take a look at. See, think about that maybe, some of the redness and irritation sometimes could shift because you have too many inflammatory process, too many things that are happening with these minerals you're putting on your face, with water, with tap water. Kyla is saying, what are your thoughts on tranexamic acid for hyperpigmentation? I think oral is better than topical, but be really careful with it. It's something I'm very comfortable with doing because I do really a holistic approach with seeing really top to bottom for patients, medical issues, everything like that, to really make sure that it's safe to do. But we have to, be careful with it. But at that same time, it does work very, very well for patients with melasma. It helps with the vascular component with melasma. The issue with it, though, is that it could cause blood clots if you take it oral and you take a certain dose inappropriately for certain people. Sonia is saying, had my first CO2 laser in June. I'd like to do it again. Is there a specific time needed between treatments? It depends on how you've healed. So let's see. Usually it's about 3 to 6 months. Hi, Alan. How's it going? I didn't see you earlier there. And Alan is saying he used bottled water first month after treatment. Awesome. Alan, I only have your first result. Alan came in again in July, And then I did a follow-up with him today. Actually, his skin looked amazing now. And he's going to come by next month, and so we'll show you his result again. But actually, I want to show you, this was after just his first treatment. And I'm actually going to pull it up. Just bear with me just a quick moment here. I know I'm missing a few questions here. Just one quick second. I'm going to try to pull up his results. He just came out. I just saw him today for a follow-up, and it's just like, look at this. I'm going to show you what Alan's scars were like. And he had severe acne scars. And Alan is glowing now. He is glowing. And I have to show you, like, it's just amazing to see this kind of progress, this kind of improvement. And from someone out of state, like, he was really good with sun exposure, really good with following our instructions. And you could see, actually, let me just see if this is after his first session. And we did his first session in end of February. And then you can see where he's at right now. So let me try to kind of get this a little bit more organized for you so you can see it a little better. But his skin looks amazing now, like even better than where it was right now, because we did a second session for him in July. And I think that really pushed things over the edge for him, because I saw him and his skin looks so tight, looks so firm. And there's just very few scars I saw now on his photos and from the call that we had. It's amazing to see, amazing. So I want to show you this, because his case, he has severe scars. He's also has a couple of barriers with him, is that he did still have oily skin. He's darker skin type as well. We had to be really careful with him, but we still ended up getting an amazing result, and he has no pigmentation issues whatsoever. So amazing results actually for him. And this is after his first session. And now when I spoke to him right now, it was 3 months after his last session, and his skin looks even better. So it's like incredible improvement actually for deep, thick scars like his. And he's honestly one of the people, like one of the reasons why I just love what I do. Honestly, it's like, first of all, really amazing person. Thank you so much for always like helping people out when they come on. He just really, like, he doesn't want people to suffer like he does, and wants people to know. He said that a lot of people ask him what he did, but he spent so much money doing things beforehand, and thought he just wanted to go to the best person for this. And it was just like, so he came all the way out here to do this, and now he came out twice, and incredible improvement already for him. So what did he do? So he did Taylor Liberator Subcision, TCA Cross, and ablative CO2 laser. And then he, after this point, we did Bellafill, ablative CO2 laser, more TCA Cross for him. Let's see. Haley's saying, do you suggest TRL laser for deep pitted acne scars like this photo? I don't really actually typically recommend it. It's okay, but I don't necessarily think it's the best option, to be honest with you. I don't think it's powerful enough to be able to do it. I think it doesn't really stimulate enough collagen production. So it does help with like the pigmentation on the surface, things like that, but not so much with like the scarring itself. Let's see here. Why do some people not see significant changes in scars with Subcision and CO2? Well, it's a good question, actually. Something I kind of grapple with too, because every once in a while there is a patient that like I wish like would have had a better result. And I'll go through it a little bit. So things that really factor into it, people, if they're smokers, they're previous smokers, it's a big issue. If they're not at their ideal weight, it's a big issue. If they're either planning on, before or after losing weight, they could potentially just be now loose skin, things like that afterwards. And that could be a problem for people. It makes their scars look a little bit worse. The volume loss looks a lot worse. So, that's something just to pay attention to, that we want to make sure that your weight is relatively stable. I want to make sure that your diet is otherwise good. Like I said earlier, like if you're drinking a lot of dairy, that causes more oil production. That's potentially going to cause you to break out more. And so that's something I'm going to talk to you about, because I want you to not do things that could potentially delay the collagen response. And, other things that are potential factors into it, of course, skin type is something else, genetics or other things. Those things you can't really control. But the things you can definitely control, and most people do, but some people don't, is sun exposure. Sun exposure is something you just have to be disciplined about. You know that you've invested a lot to do the procedure. You've waited a long time to get the procedure done. So be really, really careful when sun exposure afterwards. Those are the things that kind of factor into it. The final thing I would say, though, is that after you do subcision, and a lot of times I tell patients this, but it's a little bit unclear sometimes still, I think, that we aren't solving the volume loss completely after that first session. If I am doing a little bit of volume, it really is just a little bit, I really want to keep your natural anatomy. It's really, really important to do that. So I make sure that when I'm doing subcision, it's in the right layers. We're not going anywhere else. I'm going exactly where it needs to be done. So if I feel like I can't do that first session, I just tell you that we're going to have to do this under a second session more with volume that second session. And that's going to ultimately help us out a lot more. The volume loss that somebody has really does make scars look a lot deeper. And so we are ultimately still going to have to do something for volume. It gets very confusing for people. It gets, what does that mean? What am I going to look like? It's tough to say, because unless we are capable of really seeing the amount of fat loss and fat destructions in someone's face really cheaply and easily, I think it's going to be really difficult to be able to say until you actually break up the scar tissue, help it pop up there. And now whatever you place in that pocket now is going to fit a lot better without a donut effect. Sometimes if somebody doesn't do proper subcision and then they do filler or they do fat transfer on a patient, it basically doesn't hold very well. And now it's kind of going outside of the scars. So basically the scar is being pulled down and you are placing filler around the edges now, and it's basically causing like this donut look. And so we got to be careful. We got to really make sure that we broke up the scar tissue really well. And I had a patient, he did 6 subcisions. We made a video of him just recently, just a few days ago. And you could see really, really severe thick scars. He did 6 subcision sessions elsewhere. Some people that, they consider themselves the top acne scar doctors. And it's over and over and over I've seen that where I did it and I ended up going in there and there was so much scar tissue in there, and I was like, did you have new breakouts, anything like that? And he said no, nothing else. Like he just never even saw that they were breaking up all those scars the way I just broke up all those scars. So you got to do it thoroughly. This is an invasive procedure. I want to make sure that it's done super well. I want this to be done like one shot, one opportunity, M&M style. Like we are doing this like at a super high level when I'm doing it. Like I don't want to put you through this again. I don't want to make you just blow up like that again and make you just like, go through multiple subcision sessions. I want to do it really properly and really thoroughly. So, I think that's really fun that we could do it that way. I know, T-Chan is asking, did Alan do anything to control oil production? I was borderline considering, actually, I think you did do one Accure session, but because I think, actually, if you could answer that for me, I got to double check on that. I was considering before doing anything with doing a little bit of Accutane for him, but I think we did at least one Accure session for you. Right, Alan? If you just double check with me. I can't remember offhand. I remember it was back in January or February when you did that. But our cream also helped out with his oil production. He also worked on his diet also, which I think helped out a lot. Gabe is saying, how many months apart is this? Is he going to need more sessions, CO2, laser, ablative? Yes, we ended up, so basically we did somewhat of fully ablative CO2 laser in some parts, where it was really thick around the edges. I'll actually zoom in so you can kind of see what I'm talking about over here with the thick portion of the scars. So let's see, I'm gonna go really, really close. Let's see, I'm getting confused. There's 2 photos behind it. 1 second, sorry. Let me see if I could get this bigger for you guys. It was not cooperating. 1 second. So you can see when you go really close, you can see the thick walls of those scars. And anybody who does Zoom calls with me, anybody who does a consultation with me, I'm pointing those out. I'm showing you how thick those scars are. And in his case, very, very thick scars. So we had to do ablative CO2 for that. There's just no other way around it. Like if I know people say, what about Halo? What about Fraxel? What about this? Microneedling. I don't remember how many times he microneedled, but it's like you could do it 1,000 times. It's never gonna smooth that down. And the only thing that really I found helps for these thick scars is fully ablative CO2 in those areas. But you notice I'm not going wild with a CO2 laser. I'm not at all. I'm not going to go and just like go burn down all the areas now with an ablative CO2 laser in a Fitzpatrick 4 patient, but who's sort of close to a Fitzpatrick 5 patient. So I actually was treating him more as a Fitzpatrick 5 patient. And because he's somebody who does have pigmentation, and he didn't really burn much at all, really pretty close to a Fitzpatrick 5. So we had to be very, very careful with his skin, and we were able to achieve that. So we went down, really, really smoothed that down, and then we ended up, when he came in again, doing another fully ablative CO2 laser, Bellafill that day, and then some more TCA Cross. So we'll see his new result in about a month. I think he said he's going to come by next month. We'll see what he says and showcases for us at that time. How did this happen? So someone's asking, how did this happen? Yeah, this is severe cystic acne. It's you can just imagine how painful those scars were for him. The acne was for him. Just imagine that. Very, very painful kind of acne if you look at that. And unfortunately, it destroyed so much of his skin and then also his fat underneath there. And so that's how it happened. Is really genetics play a huge factor in who scars and who doesn't scar. Not just from who has acne, but who scars and who doesn't scar. Chi Chan is saying, if you do subcision without filler, will you still see some kind of result? I mean, likely you could still see a result, but if there's a lot of volume loss, you may not see enough of it. And it just was needed in order to put the volume in there. So it's by itself sometimes not the thing that's going to give you the full result. It's one of my patients today, younger patient, just breaking up his scars. It's going to be fine. I don't think I'm going to need to do much volume. But other people, sometimes we're tackling just as you get older, you lose fat. And so we're tackling that as well. Queen MB is saying, what happens to your scars if you don't treat it as you age? So good question. I mean, there's a lot of people who are younger. One of the patients also that I was talking about yesterday, who I saw yesterday, very severe scars, 40 years old, but he looks older than he is because of how much volume loss he had. And then what happened is that when he's smiling, his scars are basically tethered down, and his skin is pulling around the scars, so it's stretching out his skin. So over time, his skin got looser, and so prematurely aged him. And so what I partially want to do is just get him back to where he should have been, and then hopefully he could actually look even better than his age. That's awesome. Sometimes he does, because you do so many lasers, you do some other things, and you do like the right stuff. Your skin quality gets better, and you look almost younger than your age, which is pretty cool. Let's see here. Are prices rising for procedures? What's the average price people pay these days for moderate scars? Moderate scars probably close to $5,000. More severe scars go to about $7,000 to $8,000. So hopefully that helps you out in terms of what people are spending. After you do a fuller combination session, future sessions like more laser or more TCA Cross, that's up to 55% off. That's what I'm doing right now. Pretty cool. So those who don't know, by the way, I'm running out of time right now, but those who know, just go to my page. You could book it directly on my page. Most of our prices, everything that we could do is on there, like that we could say on there. There's some things that like sometimes I have to see, and we have to see how complex the scar is to fix and things like that. But like vast majority of things, like for lasers, TCA Cross, like Bellafill, things like that, you can see the prices on there. You can just get an idea of what to expect. And like I said, I'm pretty clear about that. Most people spend about $5,000 to $7,000 on their scars. And I do stand by my work. I really do. So I will get you through the journey, go through from start to finish. And it's just like part of this is, just something that I love to do. But like also, I know that I could do this at an extremely high level. And so I stand by it. And look at this. This guy is saying it looks the same. If this looks the same to you, like you definitely, first of all, I hope you never get scars. And you definitely are not somebody who should go and do scar treatments, really. I know people say all the time like things like that, but like, okay, that's what you think. That's fine. It's like, I'm not like telling you to do it, but this is a very realistic result. And it's an excellent result for somebody that did it in a single session. It's really, I think that you could definitely see a significant improvement over here. He did more work. He looks even better now. We'll see him again next month and see where he's at. See like more and more. That's the journey process. I want people to know this journey process. I want it so that like it's really clear for people. That like I want everybody to see it and just understand it, because I know I was going through the same process. I went through And I was really trying to find, back in my day, there really weren't photos and like the internet. It was like when I was looking through this stuff, we didn't really have Facebook. Actually, we had no Facebook, nothing like that. And so like you just kind of had to go through word of mouth. And then usually like the plastic surgeons, they had like a whole book of things that they had and things like that. And so I would ask them for like scar results, and nobody had scar results. Nobody said it. Nobody had it. And to this day, I hardly see anybody showcasing like standardized scar results, like hardly anybody. And they say they do so much of this, and it's like hardly anybody showcases that. And it's like, I get it. I understand too, because a lot of people come out of state too for us too, things like that. But it's like, confusing for people. I'm not just like putting in other providers. I'm just saying it's just confusing for patients what to expect, what's happening. Because it's like, I could see that like, you're looking at this and someone's showing us a really harsh result earlier. And then afterwards, they're showing the patient's selfie in their car, and there may or may not be a filter on there. And like, it's confusing for people. And like, that's the result after result that someone's seeing. It's like, is that what you could achieve? It's like, I wish you could do that. It'll be really, really nice if we could get to pretty close as filtered in just like a few months. But it's a really, really, really long journey to get there. It really is. I think you could get really close to it for a lot of people. I do. But it could be a long journey. And I want it clear for people that like, it's a slower process than people think. Some people have I would say this particular patient, I saw him now again after my second session, and his results are going to be killer. And I think it's faster than most people, and most people with his thickness, his skin thickness, his scar thickness. I really do. I really think it's faster. So I love it. I'm showing you that because of that. But at the same time, I want it really clear that it could take a little bit longer for you. And that's okay. Like, just accept that some people are gonna have slower collagen production. It's not something that like is your fault sometimes. Like, maybe you are doing all your sunblock. I'm not like questioning you if you're doing sunblock. I don't know if you're doing sunblock at home. I'm just trusting you. If you say you do sunblock at home, cool, awesome. I'm glad. It's like I'm really glad you do, because that's what's gonna get you a good result. I want you to have a great result. So it's like, I don't know. I hope you are. And I hope you're using the creams I'm saying. I hope you're doing those things. But like at the same time, I also know that even if you're doing those same things, you may still have a slower collagen response compared to the next person. And it's okay. It really is okay. We will get there. The journey is slower for you. It's okay. We will ultimately still get there. And it's like, we will get there very safely. And one day you'll kind of just forget about this stuff. You'll forget about like this journey, unless you kind of want to go into it like me or something. I have some patients who are who are in med school or in residence, and they kind of want to go into this world. Hey, Mara, how's it going? Mara's saying, I love my results. Dr. Qazi is the best. Appreciate you so much, Mara. Really, really do. Hopefully I'll see you again soon too. But I do really want people to feel like they got like their full process of this part of their life done, and this chapter is closed. Like me, like it's closed per se, but then like the new chapter was like, I want to solve it for people. So it's like, I still kind of look at my skin, I'm like, I can tweak a little bit, improve it a little bit more, but like I'm like really content with it still. Like, it's really nice to have that satisfaction finally by the time I'm like 42 years old, to finally feel like that. And it took a long time. That's a long time. Probably just within the last year or so that I started to feel like really good about it. And like, this was like, I was really, really finally really happy with it. So it's like interesting, right? Like that it took that long for me. And I'm in this world, and I've been through so many different things. I did so many fractals, so many microneedling, so many all of this other stuff. I've been on tretinoin since I was 16 years old. And it's like, man, it took a lot longer for me, myself, to like feel satisfied. And I understand that like it take a while for people to feel satisfied, but like at the same time, because I did that, I know it's like, it's slow. It's okay. It's slow, but we can get there. Like, it's just like, well, ultimately you can get there, and it just depends on how bad it was. Depends on what you're trying to achieve. Some people would be really happy where this first photo was, to be honest with you. I have patients with more severe scars, and if you showed them this photo now, this would look much better for them. Isn't that wild? Actually, the perception changes so much from patient to patient. My patient yesterday thought that he had the worst scars ever, and he does have very severe scars. But one of my patients from last week had even worse scars. Another patient from the couple weeks before that would have had worse than all those guys. One of the most difficult ones that I had for really the month. And so it's interesting because almost every patient tends to think are these really severe scars? Are these really moderate? Are these really bad? And I want to I clarify this is like, for me, not particularly something I would consider a severe case, but it's your own perception of that. But like, to me, I would not say this is a very severe case, this particular person. But sometimes it is, because there's also a lot of volume loss. Surprisingly, for your age, that makes it a little bit more severe now. Like, that's something that's more urgent in my mind, because I want to prevent the laxity issue that could occur. The scars pull down, and now your skin gets loose around that deep scar, and that's going to age you really prematurely, especially in your young 20s. So that's a little bit more urgent now. So, is it moderate, severe? Now it's sort of, in a gray area, because there is a potential where you have a lot of volume loss and it's really pulled down, that this could end up becoming really problematic in this one area. So, not that it's necessarily covering everywhere of your face, but in that particular area, it could be pretty severe, actually. And so let's pay attention to that. Let's see here. MJP saying, you have to realize that your perception of severe is skewed because you deal with severe cases. Yes, it's true. It is. And that's why I just trust what patients say. So I just say, if that's what you feel like it is, I understand that. To me, it's not the most severe case, but I'm going to get you there. And it's not that severe. We could get there. But we also have to talk now about what your expectations are, because some people do think if it's just really mild and superficial scars, it's still just a really fast process. It's not necessarily still a fast process. Some people say it is going to still take you a year and a half of patience. And you have to be able to do that. You have to be able to go through that process. I don't know if you're able to. I'm not sure. There's some people that aren't. There's some people that we just can't, we're not going to be able to get them to get that happy point on time, because they're just so depressed, even after a week. It's this potentially isn't the right procedure for you if you can't understand that. You have to be in a certain place in your life. You have to be really, actually, even though this causes insecurity, it's not the number one reason for your insecurity, if that makes sense. Your other issues are under control. I don't want you to try to go bankrupt for this because you think this is going to solve, some other external issue that you have. It's not. It's gonna help you achieve the best possible version of yourself, because everything else you're also working on to make sure that you're the best possible version of yourself. And if there's anything holding you back, you've already solved that. When you're coming to me for this point now, this is because this is the thing, this is that barrier that you feel is in your life right now at this point. It's not like there's something else with your job or anything else that you're worried about. This is the main problem right now. This is the thing that's holding you back. And everything else you have under control. And really, finances, everything else, it should be that this makes sense now, and you're going to go through it, and it's this is the right time. Because for me, there was a point where it was I just want for you guys, that's what I want. I want it so that in your mind it makes sense to do this now, and if it does, I could get you a killer result. I'll get there for you. I'll put it through. I'll work on it. I'll make sure you get there. And there's so many different ways. And even if you think it's you've given up, and I'm sorry, sometimes it's does take a little bit of time, but we'll get there still. And it's that's what I'll do. I will go through things for you to make sure that we could get there at a really high level and just nail it. Because ultimately, it's not there's some something that is magical that we have to do for collagen or something like that. Ultimately, we're going to trigger it. We will start to restructure and remodel this. There's always a point, though, where we have to be very, very careful. So it may take a little bit longer for you because of your skin type, because of something else while we're doing the procedure we have to be careful with. So that's, that balancing act, we have to just, I'm never going to want to do something that's going to be so reckless for you that it's going to make it worse for you, So I don't, nobody's walking around with worse for me. So it's it feels good for me, I like doing that because it's I'm getting very great results. And yes, could we maybe push it a little bit more? Yeah, but then it's unsafe. So now you can make the scar worse, you can make pigmentation really worse. Now it's really could be unsafe. So that's the thing. It's I'm always going to put your safety first. Last question here. But Goofy Tunes is saying, can you get similar results with microneedling? No. I don't mean to laugh like that. I don't mean to say it that way. I guess I should just say, I think it's unfortunate that some people kind of pushed it, and for a long, long time they've been pushing it, that microneedling could give results for acne scars. and so mild and so minimal that I think it's really unfortunate that it's even talked about in the acne scar world at this point. Because someone like this, with these kind of severe scars, can spend thousands and thousands of dollars on microneedling, and it's hardly going to make a difference. I think that is just like unfortunate that it's sort of even thought. That's my thing with it. It's not so much that, it's not going to work at all for some patients. It's just that someone will look at a patient like this and tell them to do microneedling. And I've seen it. I've had patients like that. And I've seen these thick scars. And I do actually get upset. And I don't call people out on it, but maybe at some point one day I will just do it. I like just show people some of the ads that I see on there, some of the stories and stuff like that. And the results are ludicrous, honestly. When they show like the microneedling result, like they'll show a patient like this, and then they'll show like that his scars are gone. And it is like super obviously filtered or super obviously like poor, like different angles, things like that. And it's like really, really unfortunate to me that they do that, and they're pushing for microneedling. It's something that I can never do. And if they could do it, you know what? I will. Here's your thing right now for anybody. I've actually brought this out many times that anybody does microneedling and wants to tell me to stop talking negative about microneedling. Show it to me. Prove to me that you can get to this. Prove to me with proper lighting that you could get really, really excellent results with microneedling. I would love for it. And then if you could do that, sure, I'll start pushing microneedling. Heck, I'll do microneedling all day long on patients, because why not? Like, why would I not do it? I have a microneedling pen. Like, I like it for other things, but why would I not be doing microneedling? But you have to prove it. Like, prove that microneedling is going to do this. But nobody's ever done it. No, not a single one of these companies ever could. And that's why I was annoyed when someone was showing my result as, particularly from another company. I was very annoyed. I was like, it happened to me on like a Sunday. I was like walking around minding my own business with my family, and like after we just had, actually it wasn't even great pizza, and I was like sitting there, so I was kind of already annoyed. And then I'm looking at this, and it's like my result, and they're saying it's with a laser. It's like, this was not a laser result. I will never say this is a laser result. And it wasn't even the light laser that I used. I don't even use that laser. And it was really, really like annoying, because it's like they said that they get it from the company. So I don't know what I didn't release that to the company. The patient didn't. So it's really, really, yeah. It started with bad pizza. It's so. By the way, if anybody knows good Neapolitan pizza in Orange County, I would love it if you guys could tell me, because I like Angelina's probably, like that's probably like the one place. But like beyond that, like I don't know, like there's just not many great Neapolitan pizza places. So I don't know. Like it's like I just haven't really tried too many great places, and I've tried like a lot of them. Like that's my favorite. That's my go-to thing is like Neapolitan pizza, and I haven't found it. So if you guys know Fresh Bros, I gotta think if I've ever been to Fresh Bros. Okay, I'll give it a shot then if it's good. Yeah, but yeah, it was unprofessional of them to show my result. It wasn't this particular patient; it was another one. But show my result and say it was from a laser that I don't even use in my practice. Wild. Also, I know I went overboard, but I was also a little bit late because of some technical issues. So I will try to hit. Let me have one last question here. Let's see here. Audrey, I appreciate you for answering the questions, by the way, on there. Thank you so much for that. Audrey's been answering some people's for what the procedures was and what I do and things like that. Thank you so much for that, by the way. All right, guys, thank you. I will see you later. Actually, I'll see you again tomorrow night. So I'll kind of hit back on some of the other remaining questions. I know there's a bunch that I missed, it looks like, but